Welcome to Bone to Be Friendly Orthopedics Chat, the podcast where you can sit back, relax, and listen to interesting bone and joint topics curated by an expert and delivered with an AI-powered realistic conversational format. Join us as we explore common questions and interesting topics in orthopedics.
Welcome to the podcast. We are so glad you're joining us for this first episode on our long journey of exploration.
Great to be here.
Today, we're diving into, well, a really fascinating area, the world of orthopedics. Our mission today is really to unpack what this field is all about. Beyond the basics, maybe uncover some interesting insights.
Sounds like a plan. It's more than just fixing broken bones.
Exactly. Think of this as your guide to understanding the body's mechanics. We'll look at the scope, everything from everyday injuries to complex stuff, and even take a bit of a trip through its history, which is surprisingly interesting.
It really is. Quite a journey.
Okay, let's jump in then. What exactly is orthopedics? Define it for us.
Okay, so in simple terms, orthopedics or orthopedic surgery is the medical specialty that focuses completely on our musculoskeletal system.
Musculoskeletal system. So that's bones, obviously, but what else?
Right, bones are key, but it's the whole structure. Think joints, ligaments, those tough bands connecting bones and tendons, which link muscles to bones.
Ah, okay.
Plus the muscles themselves, and even the nerves that control it all. Everything that lets us move and holds us together.
So if I'm getting this right, orthopedic specialists are sort of like the body's mechanics, or maybe carpenters, fixing the framework.
That's a great analogy, actually. Yeah, mechanics or carpenters for the body, they maintain and repair all those structural bits, making sure we have stability and can move properly.
And the main goal is what? Getting people back on their feet.
Essentially, yes. It's about restoring quality of life, addressing conditions that cause pain or, stop people from doing the things they want or need to do. It's about function.
Right. And I think many people, myself included, maybe first think broken bones when they hear orthopedics, but it sounds like it's much, much broader than that.
Oh, absolutely. Fractures are definitely a big part of it, yes, but the scope of orthopedic care is, well, it's vast. We're talking about things like arthritis, all different kinds, which causes so much joint pain and stiffness. Sports injuries, which are incredibly common.
Yeah, you hear about those all the time.
Yeah.
ACL tears and whatnot.
Exactly. Then there are congenital deformities, things people are born with, degenerative conditions that happen over time, even infections in bones or joints, and tumors as well, bone and soft tissue tumors.
Wow. Okay, that's a huge range. And where do these problems come from? Is it just bad luck or?
It's a mix of things, really. Sometimes it's just the wear and tear of aging, Our bodies aren't designed to last forever without some maintenance. Then you have accidents, sudden trauma, overuse injuries are big too, especially with sports or certain jobs, repetitive stress.
Makes sense.
And like we mentioned, developmental issues that someone might have from birth or that show up as they grow.
So someone comes in with one of these issues. What happens next? Is it always surgery? I imagine people worry about that.
That's a common misconception. No, it's definitely not always surgery. Orthopedics uses a whole spectrum of treatments. A lot of the time, we start with non-surgical approaches.
Like what?
Well, physical therapy is huge. Strengthening muscles, improving flexibility. Medication can help manage pain and inflammation.
Right.
We might use injections like corticosteroids right into a joint. Bracing or splinting can support an injured area. And sometimes it's about lifestyle changes, modifying activities, losing weight, that sort of thing.
Okay, so trying the less invasive stuff first. That makes sense.
Exactly. Conservative treatment first, whenever possible.
But I guess there are times when that's just not enough, or the problem itself is too severe. That's when surgery enters the picture.
Precisely. When those non-surgical options don't give enough relief, or the injury, say a really badly broken bone or a completely torn ligament, just needs direct repair.
And what kinds of surgery are we talking about?
Oh, a wide variety. There's fracture fixation using plates, screws, rods, nails to hold broken bones together while they heal. Joint replacement is a big one, especially for hips and knees damaged by arthritis. Arthroscopy is very common now. That's minimally invasive surgery using a tiny camera and instruments.
Right, keyhole surgery, less recovery time.
Generally, yes. Less trauma to the surrounding tissue.
Wow.
We also do ligament reconstructions, like for that ACL tear you mentioned, and surgery to remove tumors.
It sounds incredibly complex sometimes. Does the orthopedic surgeon work alone on these things?
Rarely, especially on complex cases. Modern orthopedics is very much a team sport, you could say. It's collaborative and patient-focused.
So who else is involved?
Well, radiologists are crucial for interpreting X-rays, MRIs, CT, scans, all the imaging.
Right.
Specialists in physical medicine and rehabilitation, or PM&R, often guide the recovery process. We work with internal medicine docs to manage a patient's overall health, oncologists if there's cancer, sometimes plastic surgeons for reconstruction.
So it's a whole network coordinating care for that one patient.
Exactly. It ensures everything is considered, leading to a much more comprehensive and a hopefully effective treatment plan.
That collaborative approach must have developed over time, alongside the field itself.
It certainly has. The field has evolved incredibly.
Which brings us nicely to the history. You mentioned the name orthopedics isn't actually that old, relatively speaking, like 18th century.
That's right. The term itself was coined by a French physician, Nicolas André, back in 1741. He wrote a book called Orthopedie.
Orthopedie, and where did that word come from?
It's from two Greek words, orthos, which means straight or correct or free from deformity, and paidios, which means child.
Straight child, huh?
Literally, yes, straight child, because the initial focus back then was really on correcting skeletal deformities in children.
Like scoliosis, maybe, or a clubfoot.
Exactly, those kinds of conditions. And you know that symbol you sometimes see for orthopedics, the crooked little tree being straightened by a stake tied to it?
Yeah, I think I've seen that.
That image comes directly from Andrew's book. It perfectly illustrates that original goal, straightening the child.
That's quite a visual. But obviously, people were dealing with broken bones and injuries long before 1741.
Right, absolutely. Millennia before. The practice of treating musculoskeletal injuries is ancient. We have fossil evidence showing healed fractures, even amputations from prehistoric times.
So even early humans were trying to fix these things.
It seems likely. Some of those healed fractures show pretty good alignment, which suggests they weren't just left alone. There were probably early forms of splinting or care.
Wow. What kind of methods did ancient civilizations use? Did they write it down?
Some did, yes, and we know from archaeological finds, too. The ancient Egyptians, for instance, used splints made from things like bamboo or wood padded with linen. Some other cultures used rawhide, which would stiffen as it dried, or even clay. The ancient Greeks, especially Hippocrates around 400 BC, were quite systematic.
Hippocrates, the father of medicine.
The very same. He described techniques for reducing dislocated joints, putting them back in place. The Hippocratic method for shoulder dislocations is still known today, and he wrote about managing fractures, using traction, pulling gently to align the bones, and bandaging.
So they were really thinking scientifically about it, even then.
They were developing rational approaches, yes. And the Romans, like the physician Galen, built on that Greek knowledge, improving anatomical understanding and describing things like spinal deformities.
Okay, so progress was happening, even way back then. What about later, like the Middle Ages and Renaissance?
Well, things may be slowed a bit in the Middle Ages, but the Renaissance saw a big resurgence in anatomy study and surgery. And then we start to see the first dedicated hospitals.
Like actual orthopedic hospitals.
Sort of the precursors. Jean-André Venel founded what's considered the first orthopedic institute in Switzerland in the late 1700s, focused on treating childhood deformities. And later, places like the Hospital for Special Surgery were established in the U.S.
Right. But the really big leaps forward came later, didn't they? With major medical discoveries.
Absolutely. The 19th and 20th centuries were revolutionary for orthopedics, just like for all of medicine. Three things stand out.
Okay.
First, the development of effective anesthesia around the 1840s and later. Suddenly, longer, more complex operations became possible because the patient wasn't in agony or moving.
Yeah, that would make a huge difference.
Second, understanding antiseptic and aseptic techniques, thanks to people like Lister and Pasteur in the mid to late 1800s. Preventing infection during surgery was massive. Before that, even a successful operation could lead to death from infection.
Right, a huge barrier removed. And the third?
The X-ray, discovered by Wilhelm Conrad Röntgen in 1895, this was a complete game changer for orthopedics.
Because you could finally see the bones without cutting someone open.
Exactly. Before X-rays, diagnosing a fracture accurately was really hard. You relied on feel, swelling, deformity. X-rays allowed doctors to see the break, understand its pattern, and plan treatment much more precisely. It transformed everything.
I can only imagine. Just incredible.
And then, sadly, the major wars of the 20th century, World War I and II, spurred huge innovation in treating trauma, including severe fractures and amputations. Techniques for internal fixation using metal plates and screws inside the body really advanced during these periods.
So it seems the field grew from focusing on kids' deformities to fixing trauma to now. Well, everything musculoskeletal.
That's a perfect summary. It evolved from that narrow, straight child focus to comprehensive care for all ages, covering trauma, arthritis, sports injuries, spine problems, tumors. It's been a remarkable evolution.
And that evolution hasn't stopped, has it? Technology must be playing a massive role now.
Oh, constantly. Modern orthopedics is incredibly reliant on technological advancements. We have imaging tools way beyond the basic X-ray now.
Like MRIs and CT scans.
Exactly. MRIs give amazing detail of soft tissues, ligaments, tendons, cartilage, muscle, which X-rays don't show well. CT scans give incredibly detailed cross-sectional views of bone, great for complex fractures or planning surgery.
And surgery itself has changed too. I hear about minimally invasive techniques a lot.
Yes. Arthroscopy is a prime example. Using a small camera and instruments inserted through tiny incisions means less damage to surrounding tissues, often less pain, and faster recovery compared to traditional open surgery.
That sounds much better for the patient.
Definitely. And we're going even further with things like computer-assisted navigation.
Like GPS for surgery.
Kind of, yeah. It helps surgeons place implants, like in joint replacement, with incredible accuracy. And robotic-assisted surgery is also becoming more common, enhancing the surgeon's precision and control for certain procedures.
Robots in the operating room. It sounds futuristic, but it's happening now.
It is. And even things like 3D printing are being used. We can print patient-specific models of bones from their CT scans to plan complex surgeries beforehand, or even create custom surgical guides.
Wow. So all this tech is about better accuracy, faster healing.
Pretty much. Enhancing accuracy, improving precision, reducing the trauma of surgery, speeding up recovery, and ultimately aiming for better, more predictable long-term outcomes for patients.
Given how complex and varied all this is, it makes sense that surgeons specialize, right? You can't be an expert in absolutely everything from fingers to spines.
That's exactly right. The field is so broad now that subspecialization is essential to maintain a high level of expertise.
So what are some of the main subspecialties within orthopedics?
Well, a big one is adult reconstructive surgery. These are often the joint replacement surgeons, focusing primarily on hips and knees, but also shoulders, elbows, ankles.
Okay, dealing mostly with arthritis.
Primarily, yes, or the aftermath of injuries. Then there's pediatric orthopedics, carrying on that original tradition, dealing with all musculoskeletal conditions in children, congenital things like clubfoot or hip dysplasia, growth plate injuries, scoliosis.
Makes sense to have specialists just for kids. What else?
Sports medicine is huge. These surgeons focus on athletic injuries, often using arthroscopy for things like repairing torn ligaments, like the ACL, or damaged cartilage in the knee or shoulder.
Right.
Orthopedic trauma deals specifically with acute injuries, fractures, dislocations, often from accidents. These surgeons are experts in managing complex breaks and polytrauma.
Polytrauma meaning multiple injuries.
Exactly. Then you have spine surgery, a very complex area focusing on everything from disc herniations and pinched nerves to spinal deformities and instability.
Definitely needs specialization.
For sure. And then there's specialties focused on specific body regions. Hand surgery is one dealing with intricate problems in the hand and wrist. Foot and ankle surgery is another. Shoulder and elbow surgery focuses just on that upper limb area.
It really covers the whole body, piece by piece almost.
Pretty much. There's also orthopedic oncology for bone and soft tissue tumors, which often requires very specialized surgical techniques and working closely with cancer specialists. And even microvascular surgery for things like nerve repair or complex tissue grafts.
It's incredible how specialized it's become.
It reflects the depth of knowledge needed now. This specialization allows surgeons to gain deep expertise in a specific area, which generally leads to better results for patients with those specific problems.
So just to kind of tie it all together with some examples people might recognize, we're talking about fixing a simple broken arm, right?
Yes, that falls under general orthopedics or trauma.
And managing the pain and stiffness of knee or hip arthritis, potentially leading to a joint replacement.
That's adult reconstruction.
Repairing a torn ACL in a footballer.
Sports medicine, typically using arthroscopy.
Dealing with chronic low back pain from a slipped disc.
That would be spine surgery.
And even treating something serious like a bone tumor.
Yes, that's orthopedic oncology.
Yeah.
It really covers a vast spectrum.
It absolutely does. So, as we can see, the world of orthopedics is just incredibly broad, isn't it? And it's constantly changing, constantly evolving.
Definitely. It touches so many parts of our lives, really, affecting our ability to just move, to function, to be active.
Yeah. And tracing it from those ancient splints through Andry's straight child, past the discovery of X-rays, right up to today's robotic surgery. It's quite a story.
A fascinating past and a very dynamic present and future.
Well, we hope this initial look has helped paint a clearer picture of what orthopedics is all about, and maybe even sparked a few new questions for you listeners.
Hope so, too. There's certainly a lot more we could explore.
Indeed, and we will. Stay tuned for the next episode as we continue our long journey of exploration into other intriguing topics. Thanks for joining us.